Hello everyone. So in this video I'm going to tell you from the topic of the year what are the important topics for the third prof examination. So what are the important topic? At least from these topics we can cover our 80% of the syllabus. So you have to study everything. It's not that you have to leave in the starting, but in the last hours of the exam or the last few days of the exam, there's some topics that we have to revise. So let's get started. In the chapter 1 you have to study about the anatomy of the ear. We have to anatomy of the external ear can be asked, and the most importantly of the middle ear, because they can ask us about the anatomy of especially the walls. They can ask the medial wall, posterior wall, what are the ways landmarks which are present, and they can ask us about the well labeled diagram of the tympanic membrane. वो भी हमसे पूछ सकते हैं. Next we have the assessment of the hearing. In that ABC test is very important. We have the Rini's test, then we have the cuneiform test. They can ask us. We have the PTA, pure tone audiometry. We have the tympanometry, and acoustic reflex is important. We have para, and we have the autoacoustic emissions, OEE, which is used to measure the activity of the outer hair cells. You must know about that. In the hearing loss, the conjunctive hearing loss and its causes is important. We have the sensorineural hearing loss, and we have some causes and management of it. Then tympanoplasty, very important. So ये question को बहुत favorite होता है tympanoplasty का, various type of the tympanoplasty. So we must know about the 5 type of the tympanoplasty. Then we have the noise induced hearing loss and what type of the graph, like in that we get the downsloping graph. So that is important. We have presbycusis. Then in the vestibular function we should know about the nystagmus. Then we should know about the fistula test, which is very important. Like we have the Hall-Pike maneuver. We have the calorie test, which is also important. Vestibular disorder, we can have the BPPV. Then we have the external ear, we have furuncle. Otomycosis is important. Then we have the malignant otitis externa, which is important. We have the tympanosclerosis, which is during the deposition of the calcium during the repairment of the tympanic membrane. That is also important. Then we have the eustachian tube. You can just remember of the eustachian tube anatomy. So there can be MCQ on that, or we can have the eustachian tube function test. And in the middle ear, you can get a long question or a short note on acute suppurative otitis media, serious otitis media, its medical management, and the surgical management. That is grommet insertion, that is meningotomy. That is very important. We have the aortic barotrauma. Now this topic of the cholesteatoma is a very important. Like if you are going to study first topic, I think you should study the CSOM. In that you should have the chronic mucosal type of the otitis media, which is also called as tubotympanic, and we have the eticoatrial chronic squamosal, that is unsafe, difference, and medical management, treatment, clinical features, what are they, and what are the cholesteatoma theories. We have the Rudy's, Whitmark, Haberman, Sadie's. So you must know about that theories also. Then we have the complication. Now you have to study this topic. This is so much important topic. So full topic or full chapter has to be studied in the great detail, but in that also the main topics are acute mastocytis, petrositis. In the petrositis there is a Bradanego syndrome that is asked. Like in this there is fifth nerve involvement, so that is very important about the petrositis. Lateral sinus thrombofibrilitis, Pickett Hens type of the fever, that is a very important MCQ they ask us. Like that's a very important one. Autosclerosis, long question can ask on the autosclerosis, medical management, surgical management, stapedectomy, that was earlier management. Now we have stapedotomy, which is very important, Kahat's notch. And autosclerosis, facial nerve, parts of the facial nerve, long question. Bell's paralysis, very important, topo diagnostic test for the facial nerve lesion is important. And we have Frey syndromes. Meniere's disease, long question can ask, clinical features and its management. Then we have the external ear tumors. We have the periauricular sinus, tumors of the middle ear, mastoid, glomus tumor, or they can be MCQs like where there's the brown sign, rising sun sign that you are going to see. Then we have to say the acoustic neuroma, like very important, they can ask us, and it's a very important neuroma which is the tumor or of that CP angle and arising from the internal acoustic meters, that is internal acoustic meters, very important clinical features, and the investigation of acoustic neuroma. Then we have deaf child, causes and assessment is there. Now in the rehabilitation, Baha is there, and we have the cochlear implants, that is a short note can be asked. And otalgia, very important, referred pain, primary otalgia, second otalgia, causes of the referred pain is very important. Tinnitus, objective tinnitus, subjective tinnitus, their causes, it's important. So these are the at least will cover about 80, and also 80 to 85% of your topic for the mbbs prof exam. So okay, bye bye. If you like it, like my video, subscribe. Okay, bye bye.